morning. Welcome back to Breakfast Television. Now, we are looking at a drive this morning that is actually looking quite light, lighter than actually the last couple of days, which is quite nice because that means that a lot of you are staying at home this morning. Taking a look right now over at the Toronto-bound QEW, heading out of Burlington, you can see that things are moving just fine as of right now. Look at that, all that space between those vehicles. Taking a look at the eastbound QEW, that's moving well right now through Oakville, through Mississauga, and in towards the Gardner, heading into downtown. And I do want to mention that we did have a problem over on the eastbound 401 near Mississauga Road. Some tire debris in lane 2 from the left. That debris has been picked up and cleared out of there. You can see that the eastbound 401 is moving at the limit, both in the express and collector lanes, actually across the GTA. C-Bond Denture Adhesive Seals provide stronger all-day hold thanks to their unique gradual release technology. C-Bond, wildly adhesive. That's a look at what we have going on for your roads. And now I'll send things over to Frankie for a look at the forecast.
Hey, Steph, good morning. I'm broadcasting live this morning from Bradford, Ontario, close to my home, maintaining some distance and at the same time taking in the start of a beautiful day. Keeping an eye on weather for you as well, keeping you on track for this day. Let's take a look at a home day forecast for you as you're going to see a very pleasant afternoon. If you get an opportunity, get out there on the balcony, on the front porch, just get in some fresh air, open up the windows. Going to see a little bit of morning cloud, but through the afternoon we'll have partly cloudy skies and a daytime high above seasonal, right around 9 degrees. Seasonal highs for this time of year should be closer to 7. We're watching a system that's just tracking down to the south of us. That's what's producing this morning cloud. But you can already see the breakup in the cloud cover over through Windsor and London at this current time. And that's what we're going to get into here in Toronto a little bit later on into the afternoon. As I mentioned, a high today of 9, an overnight low tonight down to 4. Tomorrow we'll have showers, on and off shower activity around 12. But a fantastic looking Friday. Sunshine and double-digit highs. That's something to look forward to. That's a look at your 3-day weather forecast. Let's send it back over to Mel with a look at your news.
And while we are all being asked to stay home, we know that healthcare workers are on the front lines of this dangerous outbreak, putting themselves in harm's way both physically and mentally. Joining us now with insight on how our province's doctors are doing and how we can support them as well is President of the Ontario Medical Association, Dr. Suhail Gandhi. Thank you for joining us this morning.
Thank you for having me.
So first off, we do want to say thank you. Thank you to everyone who is out there. And honestly, all of these healthcare workers, practitioners should be commended, of course, putting their lives in danger every single day. So first, thank you for that.
I appreciate that.
But we want to begin here. There are 2 parts to this. One is what they're dealing with physically. Can you give us a picture? Because we are hearing from nurses. We're seeing pictures circulating about people wearing protective gear, what they're looking like and how they're feeling. What is the sense right now from doctors here in the province?
Well, I think there's certainly a sense of anxiety and there's certainly a sense of worry, because at the end of the day, what we want to do is we want to make sure that the patients of this province and the people of this province are healthy. And we're worried about what's coming. As you mentioned earlier, we're on the front lines. We're doing everything we can along with the nurses and the allied healthcare professionals. Please don't forget other people that are involved as well, like the ward clerks and the cleaners and all the staff that work at the hospitals, because even though they may not be involved in direct patient care, they have a role to play as well. Mm-hmm. And, you know, there is a sense of tenseness there, but there's also a sense of hope. We take a lot of comfort when we see people doing their part in the community, when we see people social distancing, when we see people staying at home, when we see community businesses. Like my auto mechanic yesterday, he found 100 of these N95 masks and he donated them to the hospital. So when we see things like that, that provides us with the hope that we need to help look after you.
And thank you for mentioning that, because I want to remind our viewers and any businesses who might have these protective equipment. There is a list, and you can find that on our website. And a number of hospitals are doing drives and looking for those donations. Anyone who doesn't need this equipment, this will obviously come in handy for all of your staff.
Absolutely. It makes a big, big difference, and it's really heartwarming to see the communities come together and support our healthcare workers.
I want to ask about how a lot of our healthcare workers are doing mentally. A lot of them are going in with families at home and knowing that they have to go to work. Of course, this is an oath for them, but are there supports for medical staff in how they can deal with all of this?
Yeah, and that's actually something that we're paying a lot of attention to. We've set up some support systems for our physicians. I know that the nursing associations have set up support systems for the nurses. It's really, really important to talk about how you're feeling. It's really important to talk about the anxiety that you're feeling as you go into these situations. And our association is certainly doing its part to help our members.
Indeed, it's an overwhelmed system right now. We are just looking at visuals of an assessment center here. There are other options right now that patients should potentially consider, including the idea of virtual care. Can you expand a bit more on that?
Yeah, and so one of the things that's being done in many physicians' offices, myself included because I'm a family physician, is prior to having anyone come into our office, we call them and we take a history and we ask them how they're feeling and we ask about travel history. And if there is a concern, if they have symptoms of basically cold-like symptoms, because we know that the coronavirus causes essentially the same kind of symptoms as any other virus does, right? Fever, cough, muscle aches, those kind of things. Then depending on how they're feeling, we encourage patients to stay at home if the symptoms are mild. And if the symptoms are more severe, then obviously we can encourage them to go to one of the assessment centers. But we really think it's important to make sure before you overwhelm the assessment centers that you actually try and contact a healthcare professional. If you don't have a family physician, you can call Telehealth Ontario, and they will give you the best advice that they can as well. We have a bit of a shortage of swabs right now. I know the government's ramping up their supplies of swabs and testing, and that's great, but we need to make sure that these centers aren't overwhelmed.
Dr. Gandhi, we've heard the message many times. In fact, we've been saying it many times this morning. What can we do? And really, the answer is simple, and that is stay home and take care of one another that way.
Yeah, the top three things that people can do is stay home, and stay home. And beyond that, if you're looking for some good tips on how to prevent the coronavirus, the OMA has put up a patient-facing website. So this website is designed for your doctor to you, called virusfacts.ca. And that has some other tips on the website, things about hand washing, things about appropriate rules around social distancing, and how to manage symptoms if you happen to be home.
Virusfacts.ca, appreciate that. Well, thank you so much again for your time, and all the best to you and your colleagues.
Thank you for the kind words. Appreciate that.